So at the ESMO 2021 meeting, it was great to get some updates on new data sets as well as additional data sets that we've all been waiting for. I think perhaps the most impactful data set that we've all been waiting for is the DESTINY-Lung01 trial. So this is a trial presented by my colleague, Dr. Bob Lee, and also simultaneously published in the New England. So this is a cohort expansion of the ongoing Phase Ib trial of Trastuzumab deruxtecan, a novel antibody drug conjugate directed against HER2. Now, HER2 is a very recalcitrant disease in non-small cell lung cancer. HER2 mutant non-small cell lung cancer that tends to be observed in never smokers, and we have variable, if any, efficacy with immune checkpoint inhibitors. So there's a real need to get some new treatments for these patients. This was a cohort expansion, and all patients received Trastuzumab deruxtecan, or TDXD as it's called. And I for one was really encouraged to see this overall response rate of 55%. Very, very good indeed. And the median progression-free survival was 8.2 months, and that actually translated to a median overall survival of 17.8 months for this group of previously treated patients. So that's really very encouraging data. When we look at the waterfall plots that Dr. Lee presented, nearly all patients have some form of tumor shrinkage, and tumor shrinkage was seen not only in patients that were HER2 expressing, but HER2 non-expressing, as well as amplified and non-amplified patients as well. So very interesting data. Undoubtedly, this will become a standard treatment for patients with HER2 mutant non-small cell lung cancer. The one thing we need to be a bit careful about is the adverse events. So 25% of patients in this trial had any form of pneumonitis. Now, we're very used to dealing with this in the lung cancer world, so that this shouldn't really put us off at all, but it is something that we all need to bear in mind and treat with steroids when this occurs. So overall, a very encouraging data set.